Okay, so here's what we want to go on to. We want to go on to part 2 and 3 different causes of brain degeneration. Now, one thing with these videos is the reason why I've created these things, excuse me, so that you can go back and like learn these things. So rewatch these. So these are the 3 most common neurodegenerative diseases. Now, what we're going to be really talking about here is there's basically 3 causes, broad categories of dementia. So we're just going to be handling this right in here is dementia. So we talk about dementia, and again, dementia would be like all these symptoms right here: forgetting dates, names, events, where you put your keys, forgetting like what you ate yesterday or the day before. So there's basically, most of these categories fall in the Alzheimer's disease, which we're going to be spending most of the time on, and then vascular dementia and dementia with Lewy bodies, and you can see Parkinson's disease is down in there. But you can see like there's a lot of things that can actually cause brain problems: hypothyroidism, B12 deficiency, autoimmune, alcohol, hormonal deficiencies, mixed dementia. So like really when we look at restoring your brain function, which it is possible, it's a complex thing, but we have the technology through functional medicine. I have the technology and understanding on how to actually get you better. So here's what happens initially before you get Alzheimer's, right? So first of all, we are what we call pre-dementia, or what people state here is this mild cognitive impairment, or is sometimes abbreviated MCI for mild cognitive impairment, right? So mild cognitive impairment happens 7 years before. It can happen 10, 15 years before. This is where your brain just isn't functioning the way it used to, and you're actually aware of it, that you don't have the brain capacity, your brain fatigues out, you don't have the sharpness, you can't think as quick, you forget names, dates. These are the things. So right here, this is where people have the best chance of recovery, is when they have mild cognitive impairment, when the things start to settle in. You cannot blame it on age. It has nothing to do with age. Once you walk through this series, you'll be able to tell, like we can figure out if your brain is inflamed. Like we can figure out if you're inflamed or not. Right? Diseases grow in a body that's inflamed. Mild cognitive impairment, brain degeneration happens in a body that's inflamed. That's tons and tons of research on that. So you don't have, it doesn't affect your like daily activities yet, right? So it would be something where you have affect your daily activities, like you don't know or you don't remember where you were supposed to be at 1 p.m., right? You just have poor memory. Then it progresses down the line to mild Alzheimer's, moderate Alzheimer's, and severe Alzheimer's, right? So then here, this is just the dementia scale. These are they all fall under the dementia umbrella, but Alzheimer's and vascular, these are the biggest ones. All right, so this comes from Dr. Bredeson's book. So he lists 3 main things on why people's brains start to degenerate and why people have cognitive decline. So what he states here is these are actually protective mechanisms. So when people start to develop these brain problems, it's actually your brain starting to degenerate, and I'll show you some things that the research is actually showing is this is actually a protective mechanism because your body is so toxic, it's so inflamed. The first thing here is inflammation. So there's lots of things that we can do to measure inflammation on labs. I'm just going to show you one measurement. This is called your high-sensitivity CRP. You can see down here, this is when we first took it right here. It was 19.3, and this is after we took it. It was 13. Now, this is still super, super high. What do we like to see this at? We like to see this number less than 1. This is the functional optimal range. This comes from Time magazine, and it says the secret killer is what? Inflammation, right? Everything has to do with inflammation. Inflammation, heart attacks, cancer, Alzheimer's disease. All these things are growing in a body that's inflamed. If you're inflamed, guess what's happening to your brain? Your brain is literally on fire. So we can measure this on a functional level measurement. There's like 9 or 10 different measurements that we can measure to see if your body is inflamed. Now here's the thing when it comes to your brain. Your brain doesn't say, ouch, I'm inflamed. No, that's not how it happens. What happens with your brain, it says, you know what, I'm forgetting this. I don't have the memory concentration. I'm not sleeping well. I can't think well. I don't know where I put my keys. I don't know where my car's at when I parked in the parking lot. I don't remember what I came in this room to do, right? I don't remember what I ate yesterday. I don't remember what I ate 2 days ago. This is what happens with your brain. These are the symptoms that your brain tells you that your brain's not firing right. It doesn't have any pain receptors. So the current medical research shows that it's about inflammation. You got to reduce your inflammation in your body. Now, I like this as a good pictorial. I learn by picture, so I try and present my material in pictures. You see here, this is a neuron, and these are the little arms, right? The little, I shouldn't say arms, hands. I've been using hands. And you can see how this hand will communicate down to this other neuron right here. So this is how these neurons actually get nutrients and they actually get input to survive, is through the electrical impulse that comes down here. It says, hey, wake up, wake up, wake up, start firing, start firing, start firing, right? So this is a really critical thing, is we need this correct firing. And then this right here, you can see how this is blowing up right here. This is the end of the neuron. Then it releases the chemicals right on this neuron right here, and then tells this neuron to start firing. But you can see here how this finger here is shorter and this finger is longer. So what the current medical research shows is we can, what do we need to do? We need to decrease your inflammation, right? Let me just go back to this. Inflammation. Inflammation causes your neurons to die. Point blank. It's like medical research proven. If you're inflamed, your neurons are dying. Your brain is inflamed and you have neurodegeneration. Point blank. That's just what the scientific community has proven over and over again. So first thing, we want to decrease your inflammation. Second thing, what we want to do is we want to decrease your inflammation. We want to start to grow these neurons, your fingers, so they get longer. So if this is a dead neuron, let's say this is a dead neuron right here, we can grow this finger, it can bypass that, and it can come down here and it can connect. Okay? So this is a research here article. Now what this is here, this is actually right here, this is a neuron. Okay, so what you're looking at, let me just flash back. You're actually looking at this right here. This would be the little head right here, and this is the body. So what you're looking at here, this is the head, and this is the little tail. Now what they've done in research is this right here is your immune system. This is in the brain. This is your immune system. So what they've done is they've caused someone's brain, I believe this is in rats, because they can't do these experiments in humans, right? Some of these experiments cannot be done in humans because it's unethical. So what they've done on these mice is they've caused their body to be in a state of chronic inflammation. Their brain's on fire. All these things right here are your nervous system. Now, I don't know if you're familiar, like white blood cells, like when you have an infection, if you have a bacterial infection, your white blood cells increase. In your brain, your white blood cells are called microglia cells. So they're just the Pac-Man. I'm going to draw a little Pac-Man. Remember Pac-Man right there? Okay, this is Pac-Man. So in your brain and in your nervous system, the immune system, when it's increased, are called microglia, which is your Pac-Man. Now what happens is when you're inflamed, these little neurons right here, or these little immune cells, start to attack everything. Right? Imagine your immune system, like if you had a few too many beers, right? You see 2 lines. Instead of seeing 1 line, you see 2 lines, or 4, or 16, or 32, or 100, depending on how much you've consumed, right? What happens in your body is when your body is inflamed, your immune system, called your microglia cells, start to attack your nerves. They actually start to attack your brain tissue. And you can see this line right here. You see what's happened right there? That's where that little head is right there. What's happened, or should have been, what's happened is the immune system has gone in there and attacked it and eaten that neuron up, right? It's eaten this thing right there. So what do you see? You don't see that head there. You just see a straight line. This is inflammation, okay? So what happens over a period of time is when you have these plaques, well, let me just restate what that is or show you a picture of what that is. When you have these plaques right here, so these are the plaques. This is what they call these plaques, all right? So what they've done is they've actually taken, no, this is actually in humans, they've actually taken biopsies of this, and guess what's hidden in there? Guess what's hidden? There's bacteria that's hidden in there. There's viruses that are hidden in there. There's heavy metals that are hidden in there. So this is why they're saying this is a protective mechanism. Because when everyone's chronically inflamed, they have toxic chemicals in their body. Your brain is just overwhelmed with all this inflammation and all these chemicals. So this here acts as a sponge. This amyloid beta plaque, okay, acts as a sponge, and it absorbs all the bad things in your brain. But consequently, when it does that, when it absorbs all those bad things, then your cells can't communicate, right? So why does this happen? This happens due to inflammation, because your body is chronically inflamed here. So let's get back here. So what they've come up with is your brain's inflamed, increased activation of your brain immunity and your brain immune system. Then it starts to attack the neurons, and then you have degeneration. Okay, so the first thing is, one, is that you're inflamed. The second thing is that you don't have enough nutrients. Okay, people now in this country are obese, but they're malnourished. Right? They're obese, but they're malnourished. So you could have not enough magnesium, and not enough zinc, not enough antioxidants, or you can have not enough hormones in your body. So it's a multitude of different things. So when I take a functional medicine approach, guess what? I'm looking at hormones, I'm looking at nutrients, I'm looking at your digestive system. We're taking the whole picture in. So you need hormones to support your brain. That's the facts. So this is one of my patients. You can see she's 59. She came in with lots and lots of brain issues, foggy thinking. You know, her brain just was not working right. Now, what you see here is this is a saliva test where we checked hormones. You want to check hormones through saliva. So this was the first measurement. This is the second measurement. This is the third measurement. This is the fourth measurement. Now, in here, this range right in here, this is where we want the labs to be. This is a sweet spot right in here, right? So I'm just going to cover a couple things right here. So what we want is balance and harmony. So when she first came in here, her estrogen was at 2.52. Now, we want this to be 1.5 to 7.2. Now, when she came in here, initially right here, this is another estrogen, was 15. You can see that. Where do we want that? We want that between 67 and 780. And then progesterone was non-existent. They couldn't even read it. We want this between 5 and 3,000. So we've done a different couple tests, like I did a different couple protocols on her, and we checked it 2, 3, and 4 times. This is why testing is critical. Look at what happened here. Look, we were way over. She was over medicated, right? The bioidentical hormones were way too much. So then we brought it down, we corrected it, we rechecked, and now she's in the sweet spot. Now, this here, if you look at this is actually less than when she initially came in, but look at all the other hormones, how much better she's in balance. And this is the thing, balance and harmony. We have this hormone right here, which is 15, which is 81, which is better in balance. We have progesterone, which is 10. Now we have it at 1295. We have a DHEA. This is another hormone, DHEA, which was 14. Now it's at 239. Sweet spot is there. So my point being here, if you don't have the correct hormones, if you don't have the correct zinc, magnesium, minerals, supportive nutrients, your brain's not going to fire right. This is a cause of cognitive decline. So cognitive decline is, we can actually, now at this point, we can actually restore your body to start firing your brain, decrease your inflammation, give you brain exercises that actually will start to strengthen your brain. This is a cool little slide here. This shows you all the different receptors in your brain that need estrogen. Women have more dementia, more cognitive impairment, more Alzheimer's disease than women. And they believe that this is because the hormones, women have a lot more sympathy. When it comes to the female hormones, there's a lot more different hormones that are dancing, that need to be dancing correctly and in balance. So if their hormones aren't in balance, their brain's not going to start to fire right. And these are all the different receptors in your brain that need estrogen, male or female, but in particular, females have more dementia and brain problems because they feel that the hormones are that out of balance. So for example here, Alzheimer's disease affects 2 out of 3 women. It is estimated that 1 in 6 women in their 60s are increased risk for developing Alzheimer's disease. Now check this out. This is a real interesting statistic right here, and maybe I should just read this. In her 60s, a woman's estimated lifetime risk for developing Alzheimer's is 1 in 6. For breast cancer, it's 1 in what? 12. So you have more of a probability of getting Alzheimer's disease than breast cancer, ladies. So this is why you have to look at your brain, your body, on a functional medicine basis and take your whole beingness, look at you as a human being, not just someone that has a mild cognitive impairment or dementia, but look at you as you. Look at you as a human being and look at all your systems, not just one system. This is another one of my patients right here. This is another one of my patients right here. So you can see this is when she first came in, right? Look at that. I mean, they were non-existent. Progesterone, DHEA was non-existent. Testosterone is non-existent. So what did we do after? Look at here. Now look at her estrogen. Look at her progesterone. Look at her testosterone or DHEA. Look at this is a sweet spot. Like this is where we want the labs to be right in here. Okay. So again, this is a 50-year-old woman. She had a lot of autoimmune disease. She had brain fog. She had early signs of dementia. What do? We just put her in balance and harmony. Balance and harmony. Now this is the third thing that Dr. Brennistein has come to find out, that people will have metals or biotoxins. What do I mean by biotoxins? Are just like viruses and bacteria that build up. So these are some testings that we do. This is a test right here. This is Epstein-Barr Virus or mono. I don't know if you remember that, but this is a person. This is a young person, a male, 35 years old right now. He has early signs of dementia at 35 years old. He runs a company that does $2.5 million in business, and he can't go to work. That's where he's at right now. So we're doing a functional medicine workup, a functional neurology workup, and these are some of the tests that I got back. So this is a virus. So viruses will get in your brain and cause your brain to be on fire. Viruses will. So you can see here, there's a couple different things that we measure. We want this to be negative as less than 18. He's at 135. There's a couple different things, 135 and 117. So he is loaded with a bunch of different viruses. Here's another virus, 𝗕𝗿𝗵𝗿𝗺𝗈. So what happens here, really quickly, is this is going to be human DNA. This strand right here is human DNA, right? This is human DNA. What happens with the viruses actually go and insert them in your DNA. That's how a virus works, right? That's the virus. See, this is the virus. It inserts itself into human DNA, in your DNA. So what happens now is when you have, let's just take this Epstein-Barr virus, this EBV, Epstein-Barr virus, and it inserts itself into your DNA. When it inserts itself into your DNA, that DNA is in your brain, right? Because the DNA is in every cell. So when it's in your DNA and it's in your cells, what happens to your immune system? It starts to kick up. Why? Because it sees this virus in your cells, which is in your DNA, and your immune system says, hey, that just doesn't look very familiar. It looks kind of odd. It looks like it shouldn't be there. It looks like there's a virus in there. It looks part human, but it yet looks part virus. So what does your immune system do? Your immune system starts to fire up. When it starts to fire up, it starts to attack it, right? And when it starts to attack it, it just doesn't attack this one little thing, this one little cell, but it attacks what? Your whole entire brain. This is why your brain is on fire. So if your brain's on fire, your brain is going to start to neurodegenerate. If your brain starts to neurodegenerate, this is where you're going to get foggy thinking. Your brain's going to start to diminish. You're not going to be able to think. Short-term memories are going to start to elapse. So we really need to take a functional medicine approach. Now, just going through these couple different series right here, I hope you can start to see these couple different modules. You can start to see how we're connecting the dots where you can actually get better from brain problems and mild cognitive impairment.